Hi, my name is Yo-Yo. I am your fertility nurse at Gen 5 Fertility Center. As a world-class fertility center with the best team, the best equipment, the best protocol, and the best technologies, Gen 5 is dedicated to your fertility success. Today, we'll be talking about an area of infertility that is never discussed enough, that is male infertility. Up to 50% of all infertility cases are due to male factor, partially or in whole. Then why is it not discussed as much as female infertility? Besides unawareness, a lot of it has to do with the impact of infertility to men's ego, their self-image, and their self-esteem. We know that it can be very embarrassing and stressful for many men to discuss this private and intimate issue and reach out for help. But don't worry. Today, we'll bring you to meet with a top male fertility expert, Dr. Martin Bastuba, and get your questions answered. One of the reasons for those of you who are watching, we're interviewing you today is because Father's Day of this year is coming. And we know that there are many men out there who are trying to become a father, but they haven't been able to yet. So we hope that today we will be addressing some of their questions and concerns and letting them know that being a male fertility expert isn't the most scary thing in the world. And so I have a list of questions from our patients, and so we'll go over them, and hopefully we will together as a team help them get pregnant very soon. So the first question that I have for you today is, what are some common causes of male factor infertility?
After having done this for nearly 30 years, I think I've seen just about it all. But I think if we want to just keep it simple, we have things where we have low sperm numbers, sperm abnormalities, let's call it. The numbers could be low, they could be zero, the sperm could be misshapen, maybe they're not swimming very well. So that's one group. Then there could be another group of patients where it's poor delivery. Maybe they have diabetes, maybe they've had a spinal cord injury, and the sperm is not leaving their body like it should. So that would be another whole group of patients. And then there are a group of patients that have hormonal abnormalities, and we can identify them and correct those hormonal abnormalities. These are one of my favorite group of patients because oftentimes they will respond very nicely and have sperm counts that come back very nicely.
What are some of the do's and don'ts that men should know as far as maintaining or even improving their sperm quality? Do you have any suggestions?
I guess what I would say is moderation in everything. This is a typical fact of life. For people who drink too much, who smoke too much, who are morbidly obese, trying to get back towards a normal, healthy existence is wise. The other thing is, at least in the United States, there are a number of men who are on these bodybuilding, testosterone, and some of these type of medications. They can shut down sperm production.
That's important
and
to know.
So that is something that, especially for Father's Day, with us guys trying to look the part, sometimes that can have a negative impact on fertility. So all these things, generally a lot of things that a cardiologist might tell you that are good for your heart also can be helpful to have good sperm production.
We know this for women, their egg quality is strongly correlated with their age. So as women age, their egg quality decreases. But what about for men? Is age a huge factor for men?
Not so much so. Men keep making sperm in general to the day they die, unless there is a hormonal abnormality or other issues going on. And so we have patients in their 20s, 30s, 40s, 50s, 60s, into their late 70s. I've never had an 80-year-old patient that I can recall from a fertility standpoint, but I had a 79-year-old patient.
79 years old.
And so men keep making sperm really well into their later decades. Now the amount of ejaculate decreases, but then the concentration seems to go up so that the actual number of sperm, it decreases some, but it's nowhere near the drop-off like is experienced in females.
What about some risks involved with children born from an older man, let's say someone who's in their 50s or even 60s?
I think Well, the best data I ever saw was delivered by an epidemiologist 3 or 4 years ago. And one important concept is if either the male or the female are younger, that is good. So that if both male and female are over 40, then the numbers go up slightly. As men get into their 50s and 60s and 70s, there is something that increases known as aneuploidy, and this would be abnormal DNA in a very general sense. However, the actual risk to the child from the data that I saw was somewhere in the 1.8% increase in congenital malformations. So still quite a low number when you look at the overall picture.
In fact, a lot of you might know that a lot of the famous people, the celebrities, they actually have a father that's at an older age, and their mother usually at a younger age. So for older men, basically, they can still make genius. They can make very smart babies, very healthy, normal babies.
I would agree with that completely.
We know that male infertility can potentially impact a man's self-image and self-esteem. So this process also can be very stressful. What we can do to make this process less stressful and a little bit easier for them? What a support system do we offer for them?
In fact, one of the things that drives me in my whole life and in my practice is the concept of quality of life and how important fertility and sexual function is. These two things are critical for couples and also for a man's self-image. So male fertility issues, yes, can be very difficult for men to grapple with. But after having done this, as I say, for decades, we feel very comfortable taking the man in, letting them know that this does not make them less of an individual. They're just a human being. They're doing the best they can. Many times, in fact, the majority of times, the fertility is not caused by something the male chose to do. It's usually a genetic thing, and so they had no control over it. Oftentimes, just knowing that is comforting to them, to know that it's not something they personally did to themselves, but that this was something they were born with. And so we work through those things. I would also say that what we don't know is much more worrisome than what we do know. When you look into a dark black room, it can seem very scary, but when you turn on a light and you know what's in that room, even if it's not something you're all that happy with, you can at least deal with the known. And in my experience, working up the male, finding out what's going on is very comforting and useful to them, even though we're not telling them always what they want to hear. Usually we are, but not always. Just the knowledge that they've done what they can do for many men is very useful for them to be able to get past the issue, find solutions, and move on in their relationship.
So what I understand is awareness is one important thing. Also, letting them know that a lot of times it's not their fault. And this happens a lot in fertility treatment. We see couples who at one point start to blame each other. It's your fault, it's your egg's fault, it's your fault, it's your sperm's fault. So it becomes more stressful for their relationship and adds more difficulty for their treatment.
Yes, I mean, infertility is a huge stressor for couples. Again, getting back to the quality of life issue, it's so important to the couple. And that's one of our approaches also, is to make sure that we try to be supportive to both members of the couple, and that it's usually not something that someone, in fact, when it is something that someone has done, typically we can treat that. If they were on a particular medication, if they were on testosterone, these types of things, almost always we can take care of that and cure that man-made issue. It's the genetic ones that usually we can't fix, that they have no control over and therefore should not feel guilty over. Because it is so stressful, oftentimes the sexuality, the sexual side of the relationship is negatively impacted because of this stress. And so it's not uncommon, because I also have a deep interest in sexual function. Maybe the male would benefit from a little Viagra from things to help with erections, to help bring that intimacy back to the couple that has been negatively impacted by the fertility stress. And so this is part, again, of your earlier question, what do we do to try to help couples? I think maintaining that intimacy throughout the trying time is very important for the relationship.
I agree. Even after you have a kid, it's important to maintain that intimate relationship. It's always important.
Absolutely.
Let's say this couple, they are already aware of their situation. They want to get started. But what's the process like to start their treatment? Can you briefly walk us through the steps of treatment? First, start probably with the workup.
For years, because I've treated patients from over 30 countries around the world and have been for nearly 30 years now, for years we've been doing telemedicine, and oftentimes intakes for patients from around the world are done through telemedicine. I wish I spoke 10 or 12 different languages. I don't, but I speak English fairly well, and through people like yourself and translators, we can talk to just about anyone, anywhere, and get the process started learning about their history and their particular situation. Once we have that going, whether they're here where I can lay hands on them or through telemedicine, we can then get the workup ongoing. Typically, this would require at least 2 semen analyses, some hormone testing, oftentimes an ultrasound of the testicles, and genetics testing would be a part of the workup also, depending on whether there is low or no sperm. And so with these things, a lot of this, frankly, is not physically needing hands-on, but much more intellectual thought process of what is going on and putting the pieces of the puzzle together for them.
This is very important during COVID-19 pandemic. So a lot of these things can be done when patients are, let's say, in another country. They can do it locally, get their workup done before they see you. Is that correct?
That is correct, and I want to share that I do have my COVID mask here. I've taken it off for this interview, but
yeah, we're good. I have my mask on.
We follow all recommendations
We're 6 foot
that
apart.
are current, correct. That the current recommendations for patients when they are with us, but certainly the use of telemedicine makes things easier, and also with stimulations on the female side, things can be done remotely, and then when they come to us, we are able to do things very quickly and efficiently.
That's great to know. So for those of you who want to start, don't be scared. You can do a lot of the pre-screening, the workup part in your own country, in your own location, to save a lot of time and also minimize your stress level. The next question is about vasectomy. A lot of people, they had vasectomy done in the past, probably because they think they're done with having children. So if they still want to have children, even though they had vasectomy done in the past, what are their chances of having normal healthy sperm and eventually having normal healthy baby?
Well, one of the focuses of my entire practice is on dealing with men who have had a vasectomy. Vasectomy is the most common urological procedure, I believe, around the world, and it certainly is in the US, so that it's a very common procedure. Very important to know that blockage of the vas deferens, the sperm delivery system, does nothing to in any way decrease sperm production. So these men are still making sperm at the same rate they would have if they had never had a vasectomy. The sperm have a life cycle, so they're broken down in the body, and that's why the testicles don't explode over time. But they're still making sperm at the same rate they would have. So the message for men is that if you have had a vasectomy, absolutely you're making sperm. It's healthy sperm. It's good sperm in the same way it was previously. usually those men have already had children. That's why they had a vasectomy. So they're proven. We know that they have good sperm. And the success rate, at least in my hands, at putting sperm back in the ejaculate is anywhere from 94 up to 98%, depending on what type of procedure that we do. There's much misinformation out there, but for an experienced microsurgeon, I've done over 3,500 vasectomy reversals, and so that's over 7,000 if you figure that almost every man has 2 testicles.
Wow.
We have a very high likelihood of putting sperm back. That's not pregnant yet because it takes 2 to tango, and the female fertility is very important, but that is one aspect. The other aspect, and I've done even more sperm retrievals on men with vasectomies, the other choice is to say, no, would rather not have my body put back together again so we can make babies the old-fashioned way. We would like to do things maybe more quickly, more efficiently, and so we can retrieve sperm and then use it for in vitro fertilization, things that the reproductive endocrinologist does, and so I've done many thousands of those procedures, and that sperm works great. It's just fine, and we can also retrieve it for fresh use, but also freeze it and use it many years later. It is still useful for in vitro fertilization. Frozen sperm, ejaculated frozen sperm, has been used for over 30 years of having been frozen.
Wow.
For sperm that from the testicle itself, I've personally used sperm at over 20 years out.
Wow.
So decades would be an easy answer. It may be 50 years. That right now is unknown.
Yeah, but I assume most people don't want to freeze it for that long, so.
Well,
Yeah.
right, and typically a female would have passed out of her fertility period
Exactly.
really even after 10 years or 15.
So for people who had vasectomy done, they don't necessarily have to have vasectomy reversal procedure done. We can retrieve sperms from their testicles. That's a good option to know, because for those of them who want to, after they have another child, they want to have the permanent contraception, they can still keep the vasectomy there. Is that correct, Dr. Bastuba?
That's one reason to choose that. Another reason would be, let's say the female is 38. She's worried that her eggs may not be lasting that many years longer. If we do IVF, we do sperm retrieval for use with IVF, and a number of embryos are created while she is 38. They have one child then. If there are embryos that are still frozen, those could be used 2 years later, 5 years later, thereby maybe extending her fertility into her 40s, because the embryos were created with the 38-year-old eggs or even younger. And so thereby it can extend a couple's fertility chances longer than they would have been otherwise.
In this episode, we discussed the causes of male infertility, what you should do to maintain good quality sperm, how to get treatment started, and vasectomy reversal procedure. If you find the first episode helpful, please like us and subscribe to our Gen 5 YouTube channel.